What are the four parts of Medicare? Let's simplify this. And before you yell at me, I promise at the end I will move out of the way so you can see this document in its entirety. So a really quick overview, and then we'll get into details. Part A, anything in the hospital. And when I say in hospital, I mean you're actually checked in. You're not in the emergency room. You're at an inpatient stay. That's all covered under Medicare Part A. Part B is anything outside of being inpatient in a hospital. Part C is when you say, hey, I don't want the federal government plan. I'd rather enroll in a private managed care plan and have them manage the benefits I'm supposed to receive under A and B. And then Part D is prescription drug coverage. And that can be a standalone plan, the kind of medications you pick up at a Walgreens. But it also can be built into a Medicare Advantage plan. Let's look at a little bit of the specifics. So Medicare Part A is your hospital insurance. It is coverage for when you are actually an inpatient person in the hospital. In other words, you're not there under observation, you're not there for outpatient services, you are not there for an emergency room visit, you have been checked into the hospital. It also covers care at a skilled nursing facility care, limited coverage up to 100 days in a benefit period. It covers hospice care and some limited post-acute home care. Medicare Part B is your supplementary medical insurance. So, as I've already stated, if you are not checked in at the hospital, maybe you're there outpatient, or maybe you're there in the emergency room or under observation, that is still going to be Part B. And Part B is everything outside of the hospital, your doctor visits, your wellness visits, labs, physical therapies, etc. So that is Part B. And let's look at the other parts. Medicare Part C is a Medicare Advantage. In other words, it is a plan that is an alternative to original Medicare. So it's not necessarily like a new part in the way of substantive coverage, but it's who is going to handle your care, and they're going to be responsible, this private managed care company, to administer your Part A coverage and your Part B coverage. And last but not least, Medicare Part D, that is your prescription drug coverage. That is the medication that you would pick up at a pharmacy. And it can work in one of two ways. You could have a standalone Part D plan because you've stayed in original Medicare and you have Parts A and B with the Centers for Medicare and Medicaid Services. Or you could have Part D coverage if you've enrolled in a Part C a Part C Medicare Advantage plan, because what happens is the prescription portion of it gets built into the plan. So now, as I promised, I am moving out of the way, and you can see the four parts on this little form that I made. Here's the complete document.